Yeah, fellow viewers, I want to address this issue of one of the reasons many people are suffering from major challenges with hypertension in the globe in general. We have a general misconception which people have been given a misinformation in most cases that when you have hypertension, you should not take salt. I'm referring to table salt or kitchen salt. Kitchen salt has a constituent which is known as sodium. That's the one main component of that table salt we use in our foods. When a person or group of persons decide to tell you not to take kitchen salt, they are helping to make you have more challenges with your hypertension. They can minimize because if they are saying you should not take kitchen salt generally, they forget to understand that it's a daily requirement. And if you have to look statistically, the human body needs about 2,300 milligrams of sodium daily, which is found in the salt for our daily body requirements. Now, in most of the foods we consume in our society today, what happens? More than 60 to 70% of the population feeds on carbohydrates, rich carbohydrate diets. And we should make the population to understand, our patients to know that carbohydrate is one of those foods that depletes, makes, when there's much carbohydrate in your diet, it helps to drop down your sodium in your body. You tell somebody not to take salt, the person go and eat carbohydrates, the salt level, the small quantity that was in the body will be depleted. Additionally, other information are also classified as misconception in some cases. They will tell them you have to drink 3 liters of water daily, drink much water. What happens when you have hydration, when there's plenty water in your body? I always tell my patients and tell other individuals who attend my sensitization program that you don't have to be advised by any individual, be it a medic or whosoever, as a group of persons not to take or to take a recommended quantity of water daily, because your water intake depends on your water loss or your physical activities. A truck pusher will not take the same quantity of water like a bank manager. Now, if the person has been warned not to take salt at all with hypertension, the same individual have been told to take 3 liters of water a day. The salt restriction have stopped you from having sodium in your diet because of hypertension, which there's no proper evidence for that. The same salt restriction is found indirectly when they tell you to take much water, 3 liters of water daily, irrespective of your activity, without specification. Because hydration leads to what? It leads to hyponatremia, a drop in sodium level. Those are things we should address. We should not only welcome patients and tell them, go and see the nurse, let them check your blood pressure, and tell those patients that they should take their regular medications. Hypertension can never be treated or be cured. How can it be treated when we encourage them to have more challenges that accompanies hypertension? We have to be honest to ourselves. You are called, you are a medic, you are a nutritionist, you are a naturopath, you are a traditional or whatever you call yourself. You have to be honest to these people in the society. If you love to treat them to get well, you reveal the truth to them. You cannot be telling a patient not to take salt at all. We minimize salt, we restrict them from certain foods that are very rich in sodium. There are foods that are super rich in sodium, which we have a couple of them. Additionally, we still have to also caution them not to go hyper, because hypernatremia is also a problem. So this aspect of us managing hypertension in our respective units should be taken into consideration. We are not teaching anybody his job or her job. We are calling the attention of those who are taking care of people who are having challenges like hypertension to have a review on their procedure of follow-up or treatment with their patients. I also want to reiterate on the fact that the foods that are also common in our society that are so rich in sodium, we need to let them know so that they don't consume such foods if they're already taking medication for hypertension or they're having crisis with hypertension. You will not ignore or you will not neglect from telling them that if you eat certain foods that are so rich, there are a lot of beverages that come alongside with sodium content. We tell them not to take alcohol and we suspend those ones that they can take those beverages. What is the essence? How many of us are counseling these patients? Those are things we should take into consideration. So we normally have to take note of the fact too that there are other foods that can cause sodium to deplete and can lead to hyponatremia that will create problems. Because a person with very low sodium can have seizures and can even have a coma, and that might lead to death because of very low sodium. Excessive exercise, insufficient water, dehydration can cause problems with that. Because if you are having plenty of water in your system, that's hydration, your sodium will drop. But when you have a lot of dehydration, your sodium will go higher. So we are preventing sodium from being too high and too low. I should know that potassium is another important mineral when we're talking about hypertension and sodium, especially when it comes to food. We should not tell them to make sure their potassium is going higher. Tell them go and eat pear, eat bananas. It will help you for your heart and your blood pressure. And you restrict them from taking salt. You restrict them from drinking water moderately. You tell them to drink 3 liters of water irrespective of their activity. It means even when they sleep the whole day without doing any physical activity, they should take 3 liters of water and become hydrated. They're indirectly depleting the sodium level in their system. Please, let's have a review. And those who are on hypertensive therapy or treatment, always make sure you go for a complete ionogram follow-up as recommended by your doctors. Call their attention because some of them are too committed to a lot of activities, but it's their responsibility to check that to know the level, the range, because averagely we need about 4,700 milligrams of potassium a day, which works alongside with sodium. There are a lot of things that need to go on, especially within the nervous system. We have the sodium potassium pump action. When you don't take sodium at all, how do you have coordination effective in the body? So we should know that the aspect of not taking sodium at all, especially in food, is a myth. Yes, they'll tell you not to take salt at all. Yes, there are other foods that contain sodium, but how often do we eat those foods? Most of our foods are carbs. That should call for attention. Please, we should have a review one more time. Thank you, dear listeners. Don't forget to hit a thumb up, and also you share this video so that it will help those who are far and near, and they can also gain some mastery on how to manage hypertension, especially when it comes to diet and sodium content. Bye bye. See you during my next video. Thanks for watching.